Hello, and welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. It is my pleasure to introduce you to incredible members of the healthcare field and uncover their unique stories, the joys and challenges they face, and what drives them in their careers. It's access you want and stories you need. Whether you're a pre-health student or simply curious about the healthcare field, I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. I don't want you to miss a single one of these conversations, so make sure that you subscribe to this podcast, which will automatically notify you when new episodes are dropped, and follow us on Instagram and Facebook at Shadow Me Next, where we will review highlights from this conversation and where I'll give you sneak previews of our upcoming guests. Today on Shadow Me Next, I'm joined by Sophie Fuller, a critical care flight paramedic, president of the Tennessee Association of EMS Providers, and co-host of the Life and Sirens podcast. In this episode, Sophie opens up about the burnout that almost pushed her out of EMS, and how sharing her stories online sparked a creative revival that reignited her purpose. We talk about the chaos and control of working in a helicopter, the wildest patient transport stories. Yes, someone really used an ambulance to get to their drug dealer, and the deep-rooted teamwork it takes to save lives from the air. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company. This is Shadow Me Next with Sophie Fuller. Sophie, thank you so much for joining me on Shadow Me Next. We've chatted a little bit before now, and I just have so much respect for you and what you have done and what you have created, even outside of the role, which is saving people is what you do for a living. You're incredible. I can't wait to have this conversation with you. Thank you for being here.
Well, you're too good to me. I'm very excited to be here. And I think what you're doing is very important because I had no idea what the heck I wanted to do. I just knew healthcare was the answer.
Yeah, exactly. And I think a lot of us are in that position, right? And we either, read about a position or we talk to a family member or a friend who's been doing this job, or we see something on TV that we think, hey, maybe I'm interested in that. But until you really get to step into somebody's shoes and shadow them, it really doesn't become real to you. And it's hard for you to see yourself doing what they do day in and day out. Sophie, you have, like I said, you have so many aspects of what you do on the day to day. All of them are equally impressive. I don't know how you keep so many balls in the air. You're incredible. Let's start though. Let's start with your primary jobs, your critical care. I can't even say your primary job because you have so many primary jobs. What we're here to talk about, which is critical care flight paramedic. Tell us about your education leading up to that. How did you first decide it's what you wanted to do, and what steps did you have to take to get there?
Yeah, definitely. So for me, and I think for a lot of people, the only thing that I knew of or had in mind was nursing. Mm-hmm. So I got a tech job at the Level 1 Trauma Center because it was so cool. And I loved it. I loved the people I worked with. But I realized that I maybe didn't want to work inside the walls of a hospital. Like, I'm super ADHD and I just needed more chaos. I know it gets chaotic in there, but I needed more. And one of my friends was a paramedic, and I was like, you know what? I'm going to try that out. So I went to EMT school. So in this state, you have to go to EMT school, then you go to advanced EMT school, and then you go through paramedic school. So while I was EMT and advanced EMT, I was actually a firefighter. And that was a lot of fun, but I really loved the medicine. So I got a job at a 911 service that was in a neighboring county. I worked for about a year and a half before I went to paramedic school just to get some clinical experience under my belt, because there's really nothing quite like 911. It is whack out here. It's crazy. So I did all that, and I worked full time while going to paramedic school, which is also chaotic, but totally worth it. Paramedic school is 3 semesters advanced school is 1 semester, and then basic school is 1 semester. So what are we at? It's like 2.5 years.
Wow.
And then once I had worked for 2 years as a 911 ground paramedic, I went to critical care paramedic school, which is an additional semester. Um, did that for a little while with a ground 911 or a ground critical care service while working the 911 truck as well. And I was like, this is a lot of fun. It's a lot more ICU vibes, I guess. It's like mobile ICU, I would say. And then I was like, okay, I'm ready for the next step. So once I got all my certs and my experience that the flight company that I work for now required, I applied after doing an internship or a fellowship with them is what they call it. And it's basically all their onboarding stuff, but you get to do it before you even apply or before you're eligible to apply. Just kind of see if it's actually what you want to do, because I would say that it's probably likely that you don't want to test out if you love being in an aircraft for the first time on your first day of work. And here I am. So it's a lot of school after you get hired as well. So I had to go to another state and do training for a full week with, all the normal HR things, but also clinical education and then aircraft education. And you take about 6 more months after your hire date, and then you continue doing like regional intensive things. And there's just a lot of clinical stuff you do, but then you have to throw in avionics into the mix, which was not my expertise, still is not my expertise, but it is so cool. So very dynamic job.
That is so dynamic. That is so cool. And I love how there was a next step, which for you, I'm sure was very motivating for you in your current role. You got to see so many different elements of things, and you said, hey, look, there's another avenue. Let me pursue that. I'm prepared for this. All the way up to being a critical care flight paramedic. Sophie, tell us a little bit more about the distinction between EMS and being a paramedic. Aside from schooling, what you get to do on the day-to-day, are there differences there?
Yeah, definitely. So for EMT basics or advanced EMTs, some states only have EMT and then paramedic. So an EMT is basic life support skills. So basic airways, basic trauma, just you're not doing a ton of invasive interventions. It's kind of, obviously they're doing CPR, they're placing airway adjuncts, but they're not doing things like intubating or, running cardiac arrest or things like that. And then once you move up to paramedic, that's when you start doing the more invasive skills, anything from obviously IVs, medication administration, all the way up to cricothyrotomies. So like you do a lot of things. Yes, it's and then when you get to critical care, you can do surgical crics, there's a very wide scope in EMS, which I love. It is so cool. Obviously lots of continuing education, but most services in my state are what we call ALS services. So a paramedic is required to be on the ambulance with an EMT or another paramedic. So the paramedic is essentially, in most scenarios, the lead clinician. So a lot of the times we compare like medic and EMT to like mid-level or doctor and nurse, just not because that's really quite an adequate representation, but for people, especially lay people who aren't really in the EMS or pre-hospital setting, it kind of makes a little more sense. We do the decision making, and then someone follows through with the orders, or we follow through with the orders. We kind of work as a team. So
no, I think I was just, as you were talking, I was like, this is a perfect representation of the teamwork model in healthcare. And I think, an interview question that would just be so amazing is describe why the teamwork model in healthcare works so well, because and you get to see it every day. You guys are out there really saving people's life. Does sound dramatic, but that's what you're doing. And maybe you could give us a couple of other examples where the teamwork model really, really, really helps when you're transporting a patient, either on ground or in the air. But I'm sure you see it all the time, how it benefits your patients.
Yeah, so it's really wild for the most part when you're working ground 911 or even my ground critical care job. We are alone in the back typically, and your partner is driving, your EMT or your paramedic partner. If you're swapping off calls, you're back there by yourself. So teamwork is really important as far as like maybe we need to divert to a closer facility. Maybe we need to upgrade to emergency traffic. You still have to communicate with your partner, even though they're driving. But one thing I absolutely love about flight is I get to be right next to my partner, who is typically a nurse. So I get to be myself and a nurse, and we get to collaborate and we get to talk about the complexities of this patient and make decisions together, which is really cool. It's not something that I was used to, and that transition was a little weird, but it's amazing because the nurses have all the experience in things like as far as ICU side of things goes, so all the drips and things like that, and kind of the paramedic is more like the expert on the ventilator and things like that, and some of the trauma. So it's I cannot imagine a better team, truly. And then some agencies even have for flight not only nurses and paramedics, but also they'll have PAs, nurse practitioners, and even docs on the aircraft. So that's even cooler. You get even more expertise and people who can do all kinds of crazy stuff with you. So I love it. It's so fun.
When you're transporting these patients, are especially in the air, are these the sickest of the sick or the most injured of the injured?
Yeah, so in a perfect world, typically, yes, these are some very critically ill patients, but sometimes we get things and we're just like, what? This person's fine. But most of the time, yes. So like if we're calling for air, it's either because the patient needs to get to a facility that is quite a distance, or maybe they just need to get somewhere in a quicker amount of time, or maybe even the ground EMS service doesn't carry something like blood, or the patient needs to be intubated and they aren't able to rapid sequence intubate. We kind of fill in the holes where they're needed, and it's so diverse across the U.S. what ground EMS can do depending on county or jurisdiction. So for scene flights, it's oftentimes because air needs to do some kind of intervention that ground can't, or they're just really far away from a major facility.
I would imagine it becomes a little bit complicated for you if you're ever looking to say move, maybe to a different state. Would you have to research kind of what you're qualified for in that instance? It's not really as universal as being like a doctor, for example.
Yeah. So EMS is obviously a lot newer than some of the other healthcare professions. So we're still ironing out all the kinks. To get an EMT or paramedic license, you have to take a national registry.
Okay.
So that's standardized. But as far as state goes, there's no like interstate license. You have to apply for like reciprocity in every single state. For the air medical I work for, I have 2 state licenses just because we're on the line. So that makes things a little more complicated. Boy, do I wish there was something that could streamline things. But I think that it does work in a way that like every demographic that we serve, every area that we serve can be so different that the EMS services have to be different, because the way you operate urban EMS is completely like it would not work in a rural setting. So I think that it is good to a certain degree, but also it would give, our paramedics and EMTs on the street more access to being able to, transfer to different states and things like that and adapt for their families. So I think that is one thing that puts limitations on us, is that you can't do like, you can't easily do like travel nursing in the paramedic aspect. There are travel contracts for paramedics. It's just you still have to get a license in that state and everything like that. So I think we should have an interstate license. That's my shameless plug.
For all those people listening who are in administration and healthcare politics.
Yes.
No, I think that's great. It really, I don't know, it kind of touches me because we think of our EMTs, paramedics, firefighters as our hometown heroes. And you guys are, like you said, they are members of the community. You guys are like knitted into the community. You serve this specific community, and I think that it really highlights that. And oh my goodness, I'm so grateful for the paramedics and EMTs and firefighters that frequently come to my house and my place of work, because it's nothing like being in a crisis and seeing you or seeing somebody that just says, I've got this. we're going to handle this. Take a seat or lay down if it's actually you that's having a problem. Let's talk about a day in your life. I would love to hear about this. So let's talk specifically about a day in your life as a critical care flight paramedic, because I think, again, that is so cool. You mentioned maybe having to drive the ambulance sometimes. You don't ever have to fly the helicopter, right?
Oh gosh, that would be so scary. And I'm not sure we would ever even make it off the ground.
Fair, valid. But tell us about a day in your life. I would love to hear about what you do.
All right. So I have to make a pretty significant drive because I live very urban and I wanted to work very rural. So that is what I did. So I drive a whopping 2.5 hours to my air medical gig.
Oh my goodness.
I know that's like cuckoo bananas, but it is a great drive. It's a great time to listen to podcasts and decompress and get ready for the shift. So I'll drive into work, grab some coffee on the way, relax. When we get there, we do crew change. So we will get our narcotics keys and our radios from the crew that is coming off, and then we'll meet with our pilot. We will do a shift brief. He'll talk about the weather, if we're able to fly or not that day, or if it's going to be like maybe not. We'll just have to update as we go. And then any concerns, if we're out for maintenance or there's certain things, maybe we're in a spare aircraft or something, he'll fill us in on that. We sign a lot of paperwork because we still have to follow FAA guidelines and things like that, even though we're medical. We get our helmets ready. We put everything in the pilot's office, and then we go to the aircraft and we check the aircraft off, which is also FAA compliant, and then state guidelines say everything we have to have on the aircraft. And it's wild what we can pack into that bad boy because it is so much smaller than you think it is. It is crazy. So we do all that. And usually if we're not taking a flight or doing some kind of education, we're either just hanging out with each other, we're studying. We study a lot. I know that's kind of weird. And that's one thing that kind of changed from ground to flight is we study a lot because there's a little bit more time for it. But when we get a flight, it's just like if you were going to get tones or dispatch to a call on the ground. So we'll get tones on our radio. Usually as a paramedic, I'll grab the blood from the cooler. I'll go grab my helmet and we'll go straight to the aircraft when it's ready. When our pilot's ready for us, either one of us is standing in what we call it fire watch. So they're making sure there's nothing crazy going on with the aircraft, and they're quite farther than the paramedic is typically. And I'll be right at the nose of the aircraft, and then we will do walk-arounds. So the paramedic will start on the nurse's side and the nurse will start on the paramedic side, and we both walk around. The pilot's already done his walk around. We make sure it's super safe. There's a lot of checklists and things like that we do. We get into the aircraft. Our helmets are already on, but we get to plug them in and we can hear what's going on through our helmets, which is super cool unless you have a terrible helmet. So I just ordered a new helmet and I'm really excited. And then we go through a checklist before we lift. And then as soon as we're lifted and everybody is good to go, and we no longer have what we call a sterile cockpit. So if we're landing or lifting, we all are quiet. So we can hear any instructions from the pilot, or if we see something that is a safety hazard, we're able to call that out. So once we're up in the air, our dispatch or our comms will talk to us and let us know where we're going, what the coordinates are, if it's a scene or what the hospital is, and then a general idea of what we're going to and how much the patient weighs and things like that. So it's a fun time once we get to where we're going. It's a bad day, or it's serious, I should say, when they say, "Oh, thank goodness you're here." I'm like, "Oh no, what are we getting into?" It's a little different if it's a scene flight. So if it's a scene flight, it's typically an EMS crew we're picking up from, which is a lot of fun. I get to see some of the people either that are followers, which is crazy, or that I work with. So that's so fun. And we do a little rendezvous. We talk about what's going on with the patient. They usually have them on their monitor and things like that. So we'll swap them over to all of our stuff. which just makes a big spaghetti mess with all the wires. So that's something I'm starting to get the hang of is cable management. And then we put them on our little cot and then we take them over to the aircraft, load them in, which is a very small space and a very loud space. So we tend to communicate with our eyes more than our mouths. And then we do the same checklist again, and then we head to whatever hospital is most appropriate. We land, and then take the patient inside, give reports, and then head back to the aircraft, do all of our checklists again, and hopefully head back to base unless we get another call on the way. So,
which happens. You get other calls and then you have to go somewhere else.
yeah, it does happen. It could be a full day of just zing, 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 and we never see the base. But it is fun. We love to fly, even if it's just we're getting up in the air and we're going to a scene and we get canceled. I'm still happy to be in the air, so call us anytime.
What a cool thing. I love how you really described the environment because I think so much, I mean, I don't appreciate the environment that I work in enough, I think, in clinic. It's quiet. It's very clean. Everybody is listening to each other. Usually there's no chaos or background noise. The amount of focus that you have to have to perform all of the safety checks to make sure cords are not getting tangled and you're not accidentally strangling your poor patient. or one of the EMTs.
Yes.
I think that it's these things that attention to detail is so easy to talk about, but until you realize what can happen if you are not attentive to those details,
absolutely,
you really don't feel like the full force of that, and a lot's on the line most of the time, when you guys, you can't just be skimming over the little stuff. The little stuff matters too. Incredible. Oh my God, that's so incredible. Okay, Sophie, you mentioned running into followers when you're on the ground, when you're picking up from EMTs. I love this so much. So Sophie, you are paramedic Sophie on Instagram, Facebook, TikTok, paramedic Sophie. You have built this amazing, strong following through your Instagram presence. Tell me a little bit about what inspired you to start sharing these stories and your experiences. And my God, you truly do. You have such a strong following. And I love that you get to meet these people in real life too.
It is so much fun to meet people in the wild, I say.
Yes.
But really what inspired me to start doing this was I became really burnt out. I was working really hard and I was exhausted, and I started to take for granted the job that I had and the opportunity I had to do what I do every day, which is amazing. And I was around a lot of people who are really burnt out too, and that were miserable doing this job, which it can happen very easily. It's exhausting many days, most days. And I was able to start sharing some of my stories, some of the excitement, and just some silly things as well. On TikTok is where I really started. And I realized that there's people who love this job as much as I do and are just as eager or as excited to get into the field as I was. And that was so refreshing. And it helped me recover from the burnout that I was going through. And I was at a place before I started sharing and collaborating and hearing people's stories on the internet that I was ready to leave. I was like, I'm just going to go to nursing school. Like I can't do this anymore. It's hurting me. And it was hurting me, but I kind of restored my excitement and my passion. And I am all things EMS all day, every day, 24/7. And I'm not burnt out. So it was very exciting to be able to see people just as excited as I was. And I don't think enough people understand what we do. So obviously, plenty of people who are first responders in the field follow me, but there's also a lot of lay people as well. And it's really exciting for them to be like, no way, like, what the heck? That's what y'all are doing. Because we're not only running emergencies, we're also doing some wild, crazy, silly things that you're just like, what was that? That happened? They called for that? Absolutely, they did. And it was a lot of fun. And those silly things that we do every day, it's really easy to get burnt out on if there's no outlet. So I'm glad that we can come together and laugh about it, cry about it, and celebrate it.
Sophie, tell me about one of the silly things, the things that you're just like, are you kidding me? What are we doing here? What is an example of that?
All right, let's see. I just shared this one not too long ago, but I this is still one of the funniest things, and I understand that maybe this was not a great use of resources, but it happens. It's going to happen no matter if we want it to or not. We had someone, and I'm not even going to call them a patient because they were not a patient. They called us, we picked them up. They said, they gave us their information. So they gave us their name, their birthday, everything, their license. They handed it all over. We put them in our computer and they refused assessment. They refused vital signs. They refused everything. They just said, I need a ride to the hospital. We get to the hospital. They even signed my computer and everything. And they're like, cool, I want to walk inside. I was like, all right. They jump out of the side door of the ambulance. They look at me and say, thanks. I just needed a ride to my drug dealer. I'm so serious. That really happened. That was so real. And they ran full sprint away. And I was like, I guess I got to call my supervisor now because I do not know what just happened. And I think about that often. That really happened. It was crazy.
Let's talk about quality questions. Now, Sophie and I did not have a chance to discuss a quality question, but this story that she's just told brings up a topic that would make a great quality question. Something like, describe a time when you witnessed misuse of medical services. Answer the question, but after answering, make sure you have a follow-up response. Something describing perhaps how you stepped in to ameliorate the situation, or what you wish you would have done, or even how the situation made you feel. Keep in mind that there's more interview prep, such as mock interviews and personal statement review, over on shadowmenext.com. There you'll find amazing resources to help you as you prepare to answer your own quality questions. Unreal. You really, we probably should have called psych at that point.
Yes, we did call the police. They did look out for this person because that was wild.
That's unreal. The fact that they gave you real information too just blows my mind.
Yes, and we had all their information, and we knew this person. Like, we picked them up before.
They wanted to come clean this ride. They're like,
I'm just gonna be honest. I'm not going in there.
My gosh. Well, you see, it's such a good example because that's a really good example of how it's a misconception, right? And it's a silly one that EMS, EMT, first responders, paramedics, you guys are doing life-saving things all day long, which you are most of the time. But then people misuse resources like that person. And
yeah, that was wild. And that's a source of burnout.
Oh my God. It's a huge source of burnout. Yeah. Absolutely. When people are wanting to use you as a glorified taxi service.
Absolutely.
Which is not the first time that's happened. Maybe the first time they admitted to doing it for drugs, but not the first time it's happened to
yes,
you.
That's why it was so wild, because they were honest about it.
Oh, well, bravo for the honesty, but bigger problems there. So I love that you addressed burnout. It's such a huge topic right now in medicine. And what's so interesting to me, and as you know, is we're doing jobs that people are desperate to do right now. Your job sounds so cool to me. And, so many people I've talked to are so excited and interested in being a PA, but you and I both know it does come with challenges, and it comes with challenges that are known. Obviously, we're going to have hard days where you lose patients or where I have to tell patients they have cancer. Those are hard days. But, the hard days are also when you are transporting patients that really don't need transport. Yeah. And doing that over and over and over. And you kind of start to ask yourself, why am I here? Why am I doing this? Time away from your family. You drive 5 hours into work, and that's these things build and they build. And there's a couple of ways to deal with burnout. And I think people haven't really figured out the perfect way, but you figured out a great one. And that's using where you're at right now and finding out how to find joy in it again. Finding the joy in what you're doing. And for a lot of people, it's talking to other people. For a lot of people, it's getting students involved, which is what I love doing. I think it's fantastic. For others, it's, maybe making some type of a podcast, which we'll talk about. And I think it's a great way to use a creative outlet, to lean on your community, and to fight this terrible thing called burnout. And it's just going to provide so much passion and joy and infuse that back into what you do. So well done.
Thank you. I'm trying my best. I just think we need to celebrate the amazing things we do more. I think healthcare in general is one of those like quiet hero situations.
Hmm.
Like we don't talk about all the good we do. So I love to hear and share the good we do because that's what
Absolutely.
matters most.
You have this incredible podcast that I am just so happy to highlight. I have loved
Thank
listening
you.
to it. Oh my God, you guys need like a full-blown TV show, I think. And Life in Sirens podcast, you and a couple of other colleagues create these fantastic episodes. Tell us what kind of stories that you like to really showcase in your podcast episodes.
Yes, so Life in Sirens was basically born from our long chats in the ambulance bay at like 2 in the morning, where we come back and we would just talk about the crazy things that we just encountered. And we finally said one day, "Oh, why are we recording this? Because I would listen. I do listen. I'm not going to lie. And we wanted to share that. Just it kind of came after my social media became something that really was an incredible outlet for all of
Hmm.
us, actually. So we talk about all kinds of things. We talk about burnout. We talk about anything from, we have some episodes that are super heavy clinical. We have some that are like light clinical, from like asthma exacerbations all the way up to like RSI. So that's rapid sequence intubation, if you're not familiar, where we paralyze and sedate people and intubate them. So we have a wide variety. So we try to touch on topics that are relatable to plenty of clinicians out there, from EMT basic to, our flight PAs and things like that. But we also talk about the fun stuff and the funny stuff and the rides to their drug dealer. I think we talked about that on episode 2. We even have listener tales, which is so exciting. We had somebody talk about a haunted station, which that was kind of cool.
Ooh.
We all have stayed the night in those haunted stations because we work 24-hour shifts, which is spooky. But I just think we have an opportunity to do a wide variety of things. We really just decide. Honestly, I know some people are like, man, you guys must spend so much time preparing for an episode. I'm just going to be honest with you. We decide, we walk upstairs to my attic, like in a 3-story townhouse. We walk all the way up to the attic. We sit down and we say, what are we going to talk about today? And that is how we decide. I am so serious. So it is very laid back. It is very chill. And it's for anybody, everybody.
It's so true though. I mean, it's so off the cuff. The fact that you guys aren't preparing these conversations. It also goes to show you how many things that you experience on the day to day that you could talk about, you know?
Yes, it is. It is seriously the weirdest job. People just pick up their phones and essentially call us, and we just show up right then, and we just walk right into their homes. And it is just like, that's wild. Like, what do you mean? It is so
On a
much
lot of
fun.
their worst days too. Like,
Yeah,
you know,
yeah. And they say, "Come on in. I don't know you, but I hope you can help."
Sophie, I'm just so impressed with you. So you have this fantastic Instagram, Facebook, TikTok platform with paramedic Sophie. You have Life in Sirens podcast. And I think what is just the most amazing and meaningful is the advocacy and the leadership that you are involved in. You are not only involved in the Association of EMS Providers, you are the president. So tell us about this association, and tell us why advocacy. We've talked a little bit about this, but why is it so important um, in emergency medicine right now?
Absolutely. So, the Tennessee Association of EMS Providers, it is a mouthful. So often we just call it the association. It sounds spooky, but I mean, it's easier to say. So it was formed out of suggestion by our state EMS board director, because we had an educators association and we have like the ambulance service association. But we didn't really have anything that was representing the people out here on the street doing the work, exhausted, tired, and burnout.
Hmm.
And we needed a way to formally advocate for them. So I am so lucky to be a part of it. And I was able to be the board director of my region before running for president. And it's an exceptional opportunity. And I get to meet so many people across the state. And I had no idea some of the things that our providers were dealing with across the board. And a lot of it had to do with, unsafe working conditions, poor staffing, things that we deal with in all aspects of healthcare. But one of the biggest things we advocate for, and especially, as far as politics go, things are kind of in a weird place for healthcare, but we really advocate for provider mental health. And our state is doing some amazing things. I know recently a bill was just passed in our state that stated if you are diagnosed with PTSD and you are in a first responder role, that it would be it could be considered associated with your job. So then you could apply for, OJI, and
Wow.
it would be covered. So that's a really big step. And I'm glad that we're doing it here. So maybe other states can follow in suit. That's not something we're specifically responsible for at the association, but we are fighting hard for things like that. And it's a great space too to bring providers together. We do all kinds of continuing ed, and we do EMS nights out, and just a place for people, just like social media, because social media, it's not for everybody, especially some of our more experienced providers. So it's really nice to bring people together and be like, there are people out there just like you who are so excited to be here, and they want to be here, and they know that change needs to be happen. So let's make it happen. So I think it's really refreshing for a lot of people.
And so important too, Sophie. Thank you so much for doing that hard work, because I could imagine after working the days that you work and the nights that you work, the 24-hour shifts that you work, and then coming and really breaking it down with your colleagues in a way that you're in a position of leadership. So when you ask these questions, it's not just fleshing out the problems. It's brainstorming, and it's generating ideas and coming up with solutions. And as rewarding as it is, I'm sure it's also a lot of really hard work, but you're motivated. I mean, you're motivated to make it better. You're seeing the fruit of your labor already, which is awesome.
It is amazing. And I work with a lot of talented and enthusiastic and creative people. And that's one thing we have to be, I think, is we just got to start getting creative, because we're in territory right now as far as, public perception and politics and things like that in the healthcare field that is absolutely uncharted. So we're going to have to create things out of nothing to make some positive changes for our patients and our, EMTs, paramedics, whatever you are in healthcare. It's a little scary right now. So
It is.
I'm glad we're able to come together and try to make a change. So.
That's awesome. Well, it seems like you guys are doing that and more. See, you guys, I told you Sophie's incredible. I just am so impressed and so grateful for all of the ways that you're really just bringing attention to everything that first responders do, and then advocating for those first responders. It's like, hey, come look at us, see what we can do, and now help us. Like, let's make big changes happen. It's just, it's fantastic. Sophie, tell me, there are people listening that are saying, this is what I want to do. This is who I want to be. I want to be Sophie. She's such a cool person. What would you tell those students? How would you motivate them to pursue something in medicine that is so great?
I will say EMS is one of the most exhausting but most rewarding things I've ever done. And it's so unpredictable. And if you like the chaos and the excitement and the sirens and the speed and thinking under pressure and thinking outside the box, I think a lot of times you'll hear like paramedics are just like the MacGyvers of healthcare. We just have to work with what we got. And it's sometimes not a lot. So if you are just excited about being a cowboy, the healthcare version, come on over, because it is so much fun. And the cool thing about EMS and first responder roles, whether it's fire or the actual EMS role, a lot of us do ride along programs. So at the company that I work for Ground 911, you don't even have to be in healthcare at all. You can do a ride along with us for the whole daytime shift. So you get to hop on the truck when the tones drop. You get to ride in the back. So that's a little weird, but it is a lot of fun because you hop in the truck. You can only see backwards. And then we arrive and you're like, oh, didn't know we were going here. And you get to participate in, the conversations and the learning. And it's so fun to have students, especially at our agency. We do anything from high school students all the way up to residents. physician
Wow.
residents will ride with us. And it's so cool to see, how their mindset is and how their, gears turn on, different types of calls and different types of patients, because it's a lot different than maybe how EMS works. So we take everybody, come ride with us, come see what we're about. If you're a student, it's very simple to get into most EMT programs, especially at the basic level. Most community colleges, some hospitals. It gets a little more tricky when you get rural, but a lot of the times my friends and we all commuted to school. It's worth it. We drove an hour to school for EMT, advanced, and paramedic. All my friends on the podcast, they did the same thing, and it is worth it. It's exhausting, but I promise, just you take the chance, because I was like, this is getting a little crazy. Maybe I should just take a step back and do the nursing thing, but just take the chance. I promise. We have nursing students that ride out with us, and they say, man, I wanted to do this. I didn't even know this was a possibility. So it is a possibility. But I always tell those nursing students who are about to graduate, I'm like, you can go fly. You can still go fly as a nurse. So I think EMS is evolving. It's getting a little more diverse in the things that we can do, the kind of providers that we have on the truck or the aircraft. So even if you maybe aren't, I guess maybe you're pre-licensed, you can consider all avenues. But if you're already licensed in some other aspect of healthcare, there's still a possibility you could fly. Or something that's becoming more prevalent is community paramedicine, which is really cool. In a lot of places, they'll put like a mid-level provider and a paramedic on a truck, and that's super cool. And you get to do more of that, like, it's almost like urgent care on wheels, and it's so awesome. I mean, we are evolving every day, and I am very excited to be here.
I'm so glad you said that. Episode 10, I interviewed exactly that, a PA who is urgent care on wheels, and his role is just incredible. And he gets to work with an EMT every day, and he absolutely loves it. I mean, he thinks he thinks it is the coolest job. So, and he actually worked, I think, in the emergency room, if I remember correctly, beforehand. It just wanted something that had a little bit more variety, wanted to meet people where they were. And those calls are they're varied as well. It's not going to be necessarily the really, really, really seriously ill patients, but sometimes it is. And sometimes, because you're meeting them in their house, they will say, I would like to stay in my house. And he has to make that decision and say, I respect that. These are your options, and here we go. But, oh my gosh, Sophie, it's incredible. Thank you so much. I think that our first responders truly are heroes, and you guys see and do the hardest things in the most intimate settings with people, oftentimes on their worst day. So Thank you for showing up. Thank you for showing up in the community. Thank you for showing up at those sites. Thank you for showing up online and educating and teaching and encouraging and inspiring. Thanks for showing up on the podcast space. And thank you so much for showing up in advocacy. You're amazing. But thanks for being on the show too.
Well, thank you for having me. And thank you for what you're doing. I didn't know that EMS was a possibility for me until I actually already graduated college. So I am so happy that you're doing this, because people need to know their options. And I think that, again, we're little quiet heroes, and we don't tell people about all the options and how cool this is.
We love what we do, and we just really, truly wanted to shout it from the rooftops. That's a common theme, really, with everybody I've spoken with. I don't care if you're an MD, DO, PA, PT, EMT, paramedic, doctor of physical therapy. We're just proud because we get to help people. It's our job. It's the coolest job ever. So
it is the coolest job ever.
Sophie with Paramedic Sophie and Life and Sirens podcast. Thank you so much. You're the bomb.
You're the bomb.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next.